I'm Woody Lax at SeniorCare EMS. I'm here to talk to you today about these devices called buckle guards. The purpose of SeniorCare implementing the use of buckle guards is to help prevent elopement of patients being transferred with psychiatric conditions from one facility to another, or in emergencies as well. The last thing that we want is that patient unbuckling on the stretcher in the middle of a busy roadway, or even a not busy roadway, and getting out there on the street and potentially getting hurt or even hurting others. How do these buckle guards work? Well, the top is designed just like a child-proof medication bottle. So you very simply press down and start to turn, and it opens up. Once that buckle opens up, you're able to put the buckle inside, close it up over the buckle, and then simply twist the cap back on it. Guards work as follows. You take this end of the buckle, the one with the press button on it, with the locking mechanism. You simply slide it over, close the top over it, and just buckle it in. And now, as you can see, this is covering the release, and the patient cannot easily access it. Not considered an actual patient restraint, just to be clear. A patient restraint would be something like handcuffs if you have the police department with you, or using some soft restraints like a cravat or a triangular bandage. That's not the goal here. In fact, we want to try and avoid the use of restraints if we can, unless we have absolutely no other choice to protect ourselves in those cases. In this case, this is to prevent patient elopement. So this is going to go on here. It's going to keep the patient from accessing the button. And when it's time to deliver the patient and drop the patient off, you simply unhook that and open this, and it's off. You press the button, and nice and simple. So that was one way to put this on. Here's another way to put it on. The buckle already closed. Simply fit it with this narrow side facing this direction. Close it over your buckle. And close the top. Nice and secure. Now, just as important as keeping this on during transport is, in an emergency, being able to remove it. God forbid, in the event of a collision or something else happens where you need to evacuate the vehicle, you want to be able to open this, and you need to be able to open it rapidly, and that's as rapidly as you can open. 1, 2, 3, it's off. And that's what you want to be able to do to get your patient out quickly in an emergency. So SeniorCare's goal here is to prevent elopement using these. We're going to demonstrate that today using 2 different buckle systems. This one buckle system, you will notice, has one inappropriate buckle, but we're going to be using it for demonstration purposes because functionally it will work the same way, at least for the demonstration. So using this center strap over here already closed, remember you need a minimum of 2 of these because that way it takes patients less time to try and get out of it. We're going to close it. This doesn't move, this doesn't move, this is closed. Patient can't access the button. For the top strap, we'll demonstrate this one's going to be a little bit more complicated because there are multiple straps involved. We're going to first thread this through. We will reach this strap over here. Remember that we're only doing this for demonstration purposes. This does not belong here. This should be buckling in the center, right? So we're going to close this top buckle over here like this. Slide this over, close it up, and as you can see, patient cannot get out. Aaron, thanks for being our assistant today. Can you get out of these? Nope. Outstanding. On this particular buckle system, this one is crisscrossed as opposed to the other that had a harness that came over this way, one over each shoulder that went straight over. This one is crisscrossed. For this one, we want to make sure that both crisscrosses are done, so while we set a minimum of 2, this particular one is going to have 3 if we have 3 available, which in all likelihood we will. Again, you can do this open or closed, so in this case I'll start with it open, I'll buckle it through, and then I will just close the cap. Same thing over here on the other side. I'm going to come around to this side to demonstrate that. This one is already closed. I'm going to slide it over closed, put the cover on, adjust the strap, all set. And here's another one for good safe measure. And by the way, you can note the patient's arms are underneath this blanket. So it's another added layer that helps prevent access to these buckles, at least from the patient. So we're going to put this one on right over. so. I'm going to close this up. I hope that you found this video informative. Purposely chose not to demonstrate this in the back of the ambulance. The back of the ambulance is not the place to start applying these guards. That's something that you need to do with these patients in the planning phase when you're still at the facility or the location where you're picking up the patient. You want to make sure that you set yourself up for success on these transports and that all this is addressed beforehand. So this should be done prior to leaving the facility where you're picking up the patient. Thank you for watching.